evidence-based medicine. So here we're going to see about what is evidence-based medicine and to list their importance and limitations, and we're going to describe how to apply the evidence-based medicine on any problems. Here we should look for the clinical expertise, research evidence, and the patient values and preferences. These are the most important thing to do and to consider in the evidence-based medicine. So EBM, it is the ability to assess and apply the best medicine evidence from the systemic research information to daily clinical problems after integrating them with the physician's experience and the patient's value. We have a triad. As I said before, we should consider the patient values and expectations, the best external evidence, and the individual clinical expertise. PBL, as I said before, the patient value, and we should think about the level of the patient. It is a process of lifelong, self-directed, problem-based learning. And decision making, it is a conscientious, clear and judicious use of the current based evidence for making the decision about the care of individual patient. And the healthcare benefits, this may be extended to the benefit not only the individual patients or even the healthcare services in the community. So application of EBM into the clinical decision enhances the opportunity for the optimal clinical outcome and the quality of life. The individual clinical expertise, patient's values and the expectations, improved patient outcome, this will be the best available clinical evidence. The best available clinical evidence is they are usually found in the clinically relevant epidemiological research that has been conducted using the sound methodology. The evidence in the literature by itself does not make a decision for the clinician, but it can help support the patient care process. The physician's clinical expertise is they refer to the clinician's cumulated experience, education, and the clinical skills. The practice of EBM is to answer the question about the etiology of a disorder, utility of the diagnostic test, effect of certain therapy or the line of treatment, and the prognosis of disease. These are all the major things we should consider, we should say in the EBM. The potential pitfalls. The clinician must always keep in mind that result and conclusion, methodology, and the data analysis. While speaking about the data analysis, they have the improper statistical analysis sometimes, and in methodology, there might be a use of wrong techniques or the methodology. In case of results and conclusion, not all the published papers contain the best results or the conclusion about the disease management. The results can be fabricated. Conclusion may be obtained from small study sample. They can't be generalized. So, evidence-based medicine requires the new skills of the clinician, including the efficient literature searching and the application of the formal rules of evidence in evaluating the clinical literature instead of routinely reviewing the contents of dozens of journals for interesting articles. Why we should have the critically appraised to weigh up how valid and useful the research will be. It depends upon the doctor's guide to critical appraisal. EBM process has the 6A. The first is assess the patient. Next, you can ask the clinical questions to patient. Acquire the evidences. Assess your performance. Apply the best evidence. Appraise the evidence. The patient. Start with the patient. A clinical problem or the question arises about the care of the patient, and the question is to be construct a well-built clinical question derived from the case. And the process, select the appropriate resource and conduct a search. While speaking about the evaluation, appraise that evidence for its validity, closeness to the truth, and the applicability, usefulness in clinical practice. Patient. Return to the patient, integrate the evidence with clinical expertise and the patient references and apply it to practice. While speaking about the self-evaluation, evaluate your performance with the patient. Here we can look for the example for the EBM application. Mrs. Mona is a new patient who recently moved to the area to be closer to her son and his family. She is 67 years old and has a history of cognitive heart failure following the severe myocardial infarction. She has been hospitalized twice within the last 6 months for worsening of heart failure. At the present time, she remains in the normal sinus rhythm. She is extremely diligent about taking her medications and wants to stay out of the hospital. She lives alone. You think she should take digoxin, but this will make her under the medical supervision in the hospital. You decide to research this question before her next visit. Here we should have good clinical questions on the properties. The PICO formula. This is the acronym used to help formulate a well-defined searchable question. Patient population and the problem. What are the most important characteristics of the patient and the health status? While speaking about the eye, intervention or exposure, what main intervention are you considering, like medical, surgical, or preventive? C. Comparison. What are the alternative benchmark or the gold standards being considered, if any? O. Outcome. What is the estimated likelihood of a clinical outcome attributable to a specific disease condition or the injury? The structure of the question might look like this, like a patient or what the problem is. We should say the problem of a patient, whether it is like for example cognitive congestive heart failure. And speaking about the intervention, we should mention digoxin. And the comparison is none or placebo. And the outcome is primary, reduce the need for hospitalization, and secondary is reduce the mortality. For our patient, the clinical question might be, in elderly patient with the congestive heart failure, is digoxin effective in reducing the need for the hospitalization? It is a therapy question, and the best evidence would be randomized controlled clinical trial. For this question, we have chosen the Medline as our resource. Medline is the most comprehensive resource for health-related literature searches and is accessible to everyone through the PubMed. After writing your question, you will obtain the thousands of research studies. You might filter the obtained research studies by reviewing the type of study methodology. The different types of methodology are arranged in a pyramid called evidence pyramid. This is the evidence pyramid, and the level of evidence is started from 1 to 5. Clinical practice guidelines, meta-analysis, systemic reviews, randomized control trial, prospective stress treatment, cohort studies. Prospective cohort has been exposed to a risk, observe for the outcome of interest. Case control studies, retrospective, subjects have the outcome of interest, looking for the risk factor. Case report or the case series, narrative reviews, expert opinions or the editorials, animals and the laboratory studies. Thank you.